months ago that we began to notice that there was an unusual cluster of pneumonia. So how long will this go? And let me, kind of explain that as well, because I think about this as really, this pandemic is going to be in 5 phases. And we are really just in the 3rd phase, but this 3rd phase may be pretty long. And so I described what's happened in the last 6 months. And the first phase was containment, and that really started sometime in January. And we were trying to slow the spread of the disease, the virus, to the United States and elsewhere. We knew we couldn't prevent a respiratory virus from really spreading around the world. But so the early travel restrictions and things we did at first were try to slow the transmission. And then in the United States, we were trying to prepare and contain whenever we did see the virus in the United States through classic public health identification and diagnostics, and then isolation or quarantine to contain it within our communities. We were quickly overwhelmed. By mid-March was that inflection where we went into this broad, almost draconian community mitigation, shelter-in-place type orders. And in May, we began to go in what's phase 3, I'll call containment, with targeted community mitigation. And I think what most of the public heard, rather than, they didn't hear the continued need for social distancing and targeted community mitigation. They heard, we're opening up, the pandemic's over, and it's far from over. And so we are back into this containment plus some targeted community mitigation. And in our own home state here in Texas, an example of that is the governor mandated facial coverings. So that's an example of a targeted community mitigation measure that these things will be needed for quite some time. So we're going to need this until we have a vaccine. So this phase 3, containment plus targeted community mitigation, is before a vaccine. And then there's going to be some things we're going to need to do even after we have a vaccine. And a vaccine isn't going to solve all the problems. It will be of help. And then phase 5 actually is one of the most important phases of this pandemic, and it really is on the preparedness cycle. We need to learn our lessons from this experience and apply them to the next pandemic, because this will not be the last pandemic. And so we need to be thinking about COVID-19. Perhaps we may be fighting COVID-19 for quite some time, measured in more than in months, if not 1, 2, 3 years. But we will learn how to live with the virus. We're learning how to live with the virus right now. Maybe we're not doing as good as we could be, but we're going to learn how to live with this virus. We know a lot more about it than we did even a month ago, but I'm humbled every day by how much we still need to learn. So that's a short and long answer of how long this pandemic will be, with also kind of a description of some of the phases to help us better understand maybe the long-term strategies that are needed as we move forward. So I'll stop there.
That's great. Thanks, Jerry, or Dr. Parker, sorry. Let's move to Dr. Lucy. Dr. Lucy, let's hear about vaccines since Dr. Parker brought it up. Oh, we need to unmute you.
I'm unmuted. Thanks again for the wonderful opportunity to join the panel today. It's quite an honor. With regard to vaccines against COVID, there's no guarantees. We've never had a vaccine against the coronavirus pneumonia, not against the severe acute respiratory syndrome SARS in 2003 in China, and not against the Middle East respiratory syndrome, or MERS, M-E-R-S, that we first found in humans in Jordan in 2012, but mostly has occurred in Saudi Arabia every year since then. In fact, trying to develop a vaccine against SARS from 2003, unfortunately showed in some animal models that the candidate vaccine actually made the disease worse when the animals were vaccinated and then exposed to the SARS virus back in 2003, 4, 5, and a few years since then, experimental studies in animals. So hopefully that won't happen with this SARS coronavirus 2 virus causing the COVID pandemic, but hope isn't that viable of a plan in such a, I consider, existential threat of this pandemic, and whatever, as Dr. Parker said, whatever's next, it might already be here, we just haven't recognized it yet. So I would say that in terms of when and what vaccines are likely to be tested in the necessary large, what we call phase 3 efficacy studies, The leading candidates, in my view, in public information is an American company called Moderna that was supposed to start about now, their big study, but it's been delayed, hopefully not too long, till the end of this month. And then Oxford in the UK, partnering with a large pharmaceutical company, AstraZeneca, has actually already started their phase 3 study, their big efficacy study, which plans to enroll something like 45,000 people, 30,000 in the United States starting in August. But already they've started enrolling several thousand people with this Oxford vaccine in the UK, but also in Brazil, where, as we all know, there's a raging epidemic within the pandemic going on in Brazil now. And also, in my view, very wisely, they've also started enrolling patients, volunteers, I should say, in South Africa, in Soweto, South Africa, at Baragwanath Hospital, where, again, because it's the winter in the Southern Hemisphere, which is in South Africa, we can anticipate that there'll be an increase in transmission of this virus. There are multiple other vaccines that will be tested soon by well-known companies like Johnson & Johnson and Pfizer, as well as other companies from Europe, such as in Germany, in Italy. And then there's a whole other issue of candidate COVID vaccines from China. There's probably 8 right now that have begun testing in China. And just the end of June last month, one of the large leading Chinese vaccine candidates by a company called CanSino Biologics was announced by the Chinese government to have been approved in China, but only for the Chinese military. And that was without doing a phase 3 large study. And I think that's because there's very little transmission of the disease in China, so you can't test for efficacy in China. So what I suspect is they may vaccinate some of their doctors and nurses in the military and send them and do a study of this vaccine in places where there is a lot of virus, like Brazil or like Southern Africa, or perhaps parts of Asia, not in the United States. So that's really the quick overview of the over 160 candidate vaccines that are being developed around the world. These are the leading ones, and we will see, in my opinion, very soon, later this month, and certainly by August, probably 2 or even 3 of them starting to be tested for efficacy and safety in the United States. And most unfortunately, we do have what's going on with a large number of cases of COVID in the United States. So hopefully where this vaccine is going to be studied will be in most, or if not all, of the places in the United States where transmission is going on. So hopefully if the vaccine is even partially effective, we'll be able to know that quickly within a matter of months. Stop there.
Thank you. Very interesting. Admiral Rogers, I know this is a very interesting piece for you as well, with thinking about like how, like the geopolitical pieces of that, when we're looking at vaccines, when we're looking at how the world is going to work together. I was wondering if you could kind of talk a little bit about how the workforce has responded to the challenges of working in a COVID-19 driven environment. What's going to happen going forward with the whole backdrop of, you know, I feel like there's been so much like, oh, as soon as we get the vaccine, everything will be normal. So can you comment on that a little bit for us?
Sure. So first, thanks to everybody who's part of this today, and thanks for the Scowcroft Institute for hosting it in Dentons. It's an honor to team with such great people. And, you know, I always say I do these because I'm interested in learning and I like hearing other perspectives. So let me share with you a few thoughts. First, I think you have to give broadly people a lot of credit for the ability to pivot relatively quickly. For many sectors out there, if, for example, high tech, software development, other areas, this idea of being physically dispersed from a single work center or office is very normal. But for the majority of business sectors out there, this idea of pivoting to a much more physically dispersed, people working at home, attempting to replicate the functions of a traditional office in remote locations, largely centered around portable digital devices, whether it be your laptop, whether it be your phone, whether it be your your pad or device. That, for the majority of people, relatively new. And I think you have to compliment people that generally they handled it pretty well. I think also you have to acknowledge the physical infrastructure, if you will, that enabled all this to happen. That Wi-Fi connectivity, that bandwidth that we have, it's performed better than I think most people thought. You had not seen significant concerns about massive outages, about infrastructure unable to carry the load, about people unable to execute their jobs because they don't have access. Now, having said that, I also would point out that one of the things we need to think about post-COVID-19 is infrastructure can be very uneven. And while for the majority of people, they're able to do video, they're able to do everything they need to do remotely, you also have to acknowledge that there are some users out there who are living in locations where that's not the case. And it wasn't a big deal when you were all going to an office and you were using infrastructure that a company provided. Now, when the majority of us are using infrastructure that we in fact are providing ourselves, that's based on what is available in the local area, as opposed to potentially major urban areas, that's going to be something I think we're going to need to think about as a society over time. Do we have the infrastructure right if we're going to get into this much more dispersed model over time? If this becomes much more the norm, that a greater segment of the workforce will now work from home, and sometimes it's not even home. I have plenty of co-workers and some of the things that I do, they didn't go home. They went to their parents' places. They went to friends' places. They went to areas where, quite frankly, they wanted to get away from significant activity associated with the virus. So they went to remote areas, Colorado, Idaho, Montana, et cetera, where the infrastructure may not be quite as robust as they were used to where they normally live. So we're gonna have to work our way through that. I think also, it'll be interesting to see, as COVID-19 will not last forever. So as we start to, at some point, transition into what the next phase looks like, it'll be interesting to see, and I think it will vary by sector. Do businesses decide that this physically dispersed model is the template for the future? As they say to themselves, think of the money I'll save for real estate and leases. Why should I pay for large, expensive office space if I really don't need it, or if I could pay for a smaller amount and save the money that way? It'll be interesting to see if that's the case. It will also be interesting to see at what point does the workforce feel confident in returning back to large physical concentrations. Because the reality is, until the workforce has confidence, I don't think most businesses are looking to force employees to return to large physical concentrations, that they will allow employees to decide, are you comfortable going back to an office? If not, what might a new structure look like for you? So it'll be interesting to see how that plays out. I think the whole school issue coming up in the fall is going to be a significant one for us as a society, because for many people, the reality is not only does a school provide education, but if we're honest, it's also a form of childcare in some ways that allow adults to feel confident that their children are in a safe environment, and that the adults, therefore, while those children are in safe environments, can do other things like work. It'll be interesting to see as we move into the fall, what are the implications in the educational structure if we don't return to in-place schools, if we stay more virtual? What are the implications on parents? What are the implications on care providers? How does that affect the workforce in its decisions? I think we're going to have to wait and see how that plays out. And lastly, because I really look forward to hearing from everybody else, I just urge everybody to think this is not going to be a one-size-fits-all scenario. Every business sector is going to be different. Employers are going to be different, and individual circumstances are going to be different. So, one thing I tell employers in my current life is be very leery of applying a one-size-fits-all solution going forward, because I don't think that's really optimized for the needs of the workforce.
Thank you. Thank you. That's excellent remarks. And it really makes me think a little bit more about the work that Mr. Hopkins, that you're involved with. You're sort of in charge of keeping everyone safe, the security of all that. How do you do that if you have such a disruption in the workforce, if you have people working more remotely, different places? each mode or each industry having a different way of going forward. How are you handling that, and how are you looking at COVID-19 for your work?
It's a great question. You know, the private sector in general has responded in very different ways, and kind of like what Admiral Rogers said, depending on who you were going into this has impacted a great deal how you're handling it. But I think one of the critical things people need to change the thinking on, and it's a little bit like what Dr. Parker said, we're not going back to anything. We're going on to something. And so the sooner we accept all this as something that's going to be with us for a while, there's not a magic cure to it, that it's going to be a risk that has to be managed, whether it's COVID-19 or frankly, what may come next. And I would defer to the other experts on the panel for that. But I think, and given where we are in the state of the world, the number of people, the interconnectivity that we have, I mean, travel will come back at some point. This will not be the last time this happens to us. So you have to think through how this is going to be managed going forward. I mean, you know, it's almost a limited parallel, at least from the way risk managers look at it, would be something akin to, you know, after 9/11, we went through a phase of shock, and we learned to live with the fact that we are going to have, you know, at least for the foreseeable future then, terrorism in our life, something we had to manage, that we had to, you know, adjust our policies on. COVID-19 has been very much like that as well. So if you take that theory and apply it forward and look at what, just some of the comments that have already been made, and taking not the virus itself, but its impact on all of society and how it's acted really as an accelerant. I mean, picking up on what Admiral Rogers said about technology, things that people thought they had 10-year plans to do to work remotely, they did in 10 weeks or in some cases 10 days. And they didn't think they could do it. And like anything else, when you have to do it, you do it. And look at what we're doing now. And I would be surprised if this is the first Zoom call anyone's been on in the last few months. And so we've learned to adjust things that were unthinkable. How would we be able to convene? How are we going to interact? How are we going to do business? And so it's really changed, I think, forever, the way we do business. Are we going to go back to offices? I think so. But you know, as Mike said, in what way? Is it going to be centralized? What's the impact of cities going to be? You know, you start to look through some of these things. And so the way we do business is changed. The reliance on technology is going to be greater than it ever has been. You mentioned in the opening that we had 184 offices. Well, in reality now I have about 20,000 offices. How do I keep the integrity of my workforce, the integrity of the work that we do, let alone the cybersecurity aspects that are created on all of this? And and the threats that have been multiplied across those risks. You know, the bad actors understand that people were ill prepared to do some of these things. So there's been a number of additional risks. We're going to have to change on not only how we interact with each other, but how do we manage that data? How do we manage the way we do business? Whatever business you may be in is going to be fundamentally different. That's leaning across into the policy space. Very much like some of the impacts that 9/11 had. You're going to see similar impacts on the tension between, in that case, it was security, more of a physical security and privacy. Now you're going to see how's privacy going to be impacted with respect to all the things we need to do on track and trace. It's important to know who an individual who's tested positive has come in contact with, but who should manage that data? What privacy laws come into that? Should that be a private company? Should that be a government? How can you assure all of that? If you aggregate that much data in any one place, obviously the bad actors are going to know that, and they're going to want to attack it. So what does all this mean going forward? The world, it's now sort of the line from the Eagles song, right? It's everything all the time. We're all living in a life in the fast lane on these things, and we're going to have to change and look at all that. Another interesting thing that we're looking at, just given the fact that we're in the legal business, how do you look at this call in and of itself? We're not convening in College Station at the Bush School. We're God knows how many different places, probably in hundreds of different locations. Well, if you apply that to the private sector, how do you even define the workplace anymore? Where is the workplace? What duty attaches to that? And one of the things we're finding that's very interesting is many organizations are starting to move away from just like Admiral Rogers said on real estate, well, paying somebody to be at your location for a specific period of time is kind of irrelevant now, because we're starting to move more toward paying people for the value. What position do you have? How much work do you put out? So the way we start to engage in a workforce is already changing, and I think you're going to see even more mobility across those workforces. And you get into employee retention, you get into a lot of other issues. So I think it's the bottom line is it's here to stay. It has forever impacted what we do, and we're going on into a new dynamic, not back to the way it was. And I think the companies that understand that are going to do very, very well. It's going to be those who adapt survive, and like any of these kind of disruptive events, there will be a lot of opportunity that comes out of it, and those who do not adjust to the change will pay the consequence. So those would be my initial comments, Leslie.
Leslie, can I jump in?
I would love if you would jump in. I was about to pick on you anyway.
No, I think there's a lot there, and although I've spent most of my career in public service and government, the military and the federal government, and now essentially in the state government, but higher education, I'm convinced that the innovative entrepreneurship in our businesses are going to be, really kind of the key of getting, helping us find this new dynamic. We already see it just in the simple things like our grocery stores where we buy our, procure our nourishment, and the things that they've employed very rapidly to try to make, the experience of shopping for our essential foods as safe as possible. And so I think there's a competitive advantage from the industries and the businesses that that move in and try to find, these innovative ways to provide kind of the essential services for the population, in a safe and new and cost-effective way. So there's going to be a competitive advantage for sure. There'll be unfortunately, some businesses that, just may not be able to make that jump and that leap. But the entrepreneurs in those businesses will probably reappear in a new business line, providing new services that are needed by society. So bottom line, we have to approach it as positively as possibly can, knowing the challenges, but we're going to have to innovate, whether we're in industry, government, NGO, universities. And a little bit about higher education. We have some unique challenges in higher education because, for the next generation, we learn from others. We learn from other humans, and that social interaction. It's hard to do that when you have to social distance. So we are going to be, we need to bring our students back on campus, but how do we do that in a safe and effective way and still provide those opportunities for growth and learning, in the classroom, but those other experiential learning opportunities that are so valuable, in formative years of young people, so they can go on and be the saviors of society, because they're going to have harder problems than we had in our lifetime. Their challenges are going to be much harder. And so we have to prepare, those of us and found ourselves in higher education have that responsibility to make sure to bring on the next generation.
Hey, Leslie, I'd like to pick up on a point that Dr. Parker talked about. I think taking that a step further, one of the interesting things in the post-COVID-19 world to me is I look for an interesting discussion about what is the role of government versus what is the role of the private sector. Traditionally in crisis, we historically tended to look for government as kind of the catalyst, if you will, for response. Traditionally in the US model, that was largely shaped by the federal government kind of acting as the central entity that coordinated across multiple states, that applied capacity and expertise and resources resident at the federal level, teamed with the states and local entities to actually solve problems. This federal government has opted for a different strategy, arguing, hey, look, we think the local entities, states are much better positioned to understand what's going on in their areas, their communities. Hey, we don't see the federal government as kind of the central piece. Rather, we think states that address it. Again, I'm not into politics. My only comment would be, so that's resulted in 50 different approaches to how we have addressed this issue, which has resulted in very uneven results across our nation. And I would argue, I don't think it's proven to be a particularly effective broad strategy. It'll be interesting to see, do we view this as a one-time thing where, hey, maybe in the future we pivot back to the more traditional government-led? Do we take from this scenario, you know, maybe the answer is based on what we've seen, to Dr. Parker and Carl's point, based on kind of the initiative and the capabilities we've seen in the private sector? Do we pivot more in the future to the private sector really is the driver for many things? I think this is going to be a really interesting question for us as a society going forward, because one of the byproducts of this interconnected world, this hyper-connected world that we live in, and that connectivity is both physical and virtual. If you think COVID-19 is a one-off, I would think that's not going to the way this is going to work. You're going to see other global kinds of challenges that are exacerbated by the nature of the world we find ourselves in now. I don't see us walking away from this hyperconnectivity. I don't see us able to stop this physical flow of interaction on a global basis. I just don't see that happening. Therefore, I think COVID-19 is a good opportunity for us to step back and say, given some of these global challenges, it happens to be a pandemic this time, it'll likely be something else in the future. Are the models that we've always used, are they still relevant? Do we need to take a look at something different?
Well, I think it's a really important point. And I want to hearken back to at least my own experience. I'll offer that up as a way to maybe continue that dialogue. And what is the role of government at all levels? What is the role of private sector, and broadly defined for something like a pandemic or other threats that could affect the globe almost, you know, simultaneously, or at least over a period of 6 months, 12 months. And so the planning and the strategy back during the G.W. Bush administration for H5N1 pandemic preparedness, which was really the first time a society thought about preparing for a pandemic and taking action to actually prepare in peacetime, so to speak, before a crisis. And at that time, there was a national strategy. There was an implementation plan that was very detailed. Some said it was micromanagement from the White House and didn't like that. But on the other hand, the strategy and the implementation plan clearly spelled out roles and responsibilities at the federal level, the state level, the local level, tribal government level, industry, businesses, universities, and those who participated in it. We could have done better of getting the message out, but there was many people across the country involved in that planning process and understood at the time that a pandemic was so large that you would be woefully disappointed if you thought the federal government was going to be able to come and rescue somebody, because you couldn't. You just can't. It's so large, and it affects, you know, all aspects of society that you have to plan it that way. And how does all aspects of society respond? You know, and what are responsibilities of even individuals and families and something like that. So there is at least some critical thinking that has gone in to this in the past, that I think as we, you know, once we get through the crisis, we're going to have to really think about these existential threats that can affect all of society, not only the United States, but we also have to work in the international community. We have to have partners, and we have to actually fight infectious diseases where they may start, and that's in low middle income countries. And how do we also help the low middle income countries have, and this for pandemic preparedness, public health, animal health capacity, so they can more readily prevent an outbreak from becoming a pandemic in the future. So there's some models that we've done in the past, and I hope we can get back to some of that, but expand those for not only pandemic, but all hazardous threats that will require a whole society of approach.
Yeah, I'll jump in on a couple of comments there, just picking up on the thread from both of you. It's interesting because the policy issues on this that have to get the speed of which, whether it's pandemic, whether it's something else that Admiral Rogers referred to, what happens next? I wish I was better at predicting that, but I'd be in a different line of business perhaps. But what we're seeing is the innovation that's going to be required to combat these things is going to come largely from the private sector, I think. But the need to be able to move through the policy, and particularly, and one of the things I say in my organization all the time, because we're in so many different places around the world, there's no such thing as a local incident. It doesn't matter whether it's a pandemic, whether it's cyber, whether it's something that's reputational. What happens to one of us happens to all of us. I don't think our policymakers have quite figured that out. The math would seem to support that argument, but politics get in the way. So I think there's going to be a very serious need coming out of this to figure out how do we harness innovation but have policy application. I think that's a big part of what we're struggling with. And we can see that in microcosms just amongst the states. Again, Mike, like as you referred to, 50 different strategies or more in this may not be the best way to approach it. It's also dividing out our resource. And there's, and I defer, Mike, particularly to you, but there's a national security element that comes out of that. How do we harness that? And there's a business competitiveness that comes out of all that goes right into the national security aspect of it. So I don't have the solution to that, but I think it's been, again, going back to the accelerant comment, it has exposed a number of weaknesses in the system. I think we realize that it's not what happens to you, it's what you do about it that counts. But Mike, I turn it back to you maybe for some comments on the national security aspects of all of this, because I think we're going to need to rethink how business interacts to get the best of both worlds.
Yeah, I think, number one, we need to think about national security much more broadly. We historically have tended to view, and look, I was part of the government for 37 years, and at the end, as a 4-star and one of the 10 senior commanders in the DOD, you find yourself in the Oval Office, in the White House Situation Room, and the tank, as we call it, in the Pentagon, with the senior leaders talking about, hey, what should our strategy be? What should we do about X, Y, or Z? I can remember in 2014 working on Ebola for what the federal government's response strategy was going to be. I was part of the transition. I served both the Obama team and the Trump team, and I can remember being part of the transition. And one of the things we talked about, the incoming team, was disaster preparedness. We happened to use a scenario, really focused along Ebola, because we had done a lot of work on that earlier in the Obama administration. So one of my takeaways is, first, we need to think about national security much more broadly. We historically tended to define it along much more narrow lines. I think that includes not only the very traditional view of nation states as threats and opportunities, but also what are those non-nation state events or activities that have broad global, broad national implications for us that potentially impact our well-being, whether that be from a health perspective, whether that be from an economic perspective, whether that be from a security perspective. When I think of national security, I generally think about those three prisms. And I think we need to look much more broadly. One of the things that I only speak for myself, found disappointing in COVID-19 is this has not galvanized a broader international approach, if you will, to addressing this issue. Now, we're lucky in the sense that this is a pandemic with global implications. On the positive side, the mortality rate could be much, much worse. Folks, imagine if we were dealing with a disease that had this prevalence, but had a mortality rate much higher, much more in keeping with other kinds of historic diseases that we've seen. We'd be in a totally different environment where, if you think it's bad now, if we were facing those kinds of mortality rates as a result of this, it would be in a total different level of impact for us. And so, as a result of COVID-19, arguably, globally, we find ourselves in the worst health situation globally we faced in a century, really, since the Spanish influenza, 1919, 1920. The worst economic impact we've seen globally since literally the 1930s, 90 years ago. And within our own nation now, the social justice issues, the questions about equality, about the rights of the individual, about how we're truly going to achieve our vision as a nation, and how we have not been able to do that to date. And some of our society members, largely based around color, have not enjoyed the same benefits as all. And we haven't seen that level of unrest on that issue in 60 years. You got to go back to the 1960s. So I think to myself, worst health issue in a century, worst economic challenges in 90 years, and worst social issues in 60. And yet this wasn't enough to galvanize, if you will, a broader international approach. Cynically, it makes me wonder, so how bad do things have to get in this world before we collectively decide as a broader global community, hey, look, there's value in coming together to address these issues. I'm hoping that as we step back in the kind of post-COVID-19 world and we reassess, I hope one of the takeaways is we've got to re-energize a global approach to problem solving, because this leaving it up to 200 and some odd individual nations, we talked about 50 states, we're leaving this up to 200 and some odd individual nations around the globe, and that is not a recipe for success when you're living in a world that is so hyper-connected, that is so physically integrated, in a world that disease doesn't recognize borders. You can develop all the theory you want, but disease doesn't recognize physical bound, these lines we draw on maps. We got to figure out how we come together collectively, because when we are placed at disadvantage as we are right now, we're not the only nation. I don't mean to imply that for 1 minute, but there are actors out there who are looking to take advantage of these opportunities. You see it in criminals who view cyber as a way to generate money, for example. You see how that's taken off in the midst of this pandemic, as we've had to work from home, as we've had to step away from the traditional cybersecurity structures we put in place in businesses and all those investments we made. And now we're all largely working at home, and our security is down to the lowest denominator based on our personal knowledge of our home systems. That's a very different scenario. You're going to see nation states increasingly, I think, over time trying to take advantage. That is not a good place where actors out there think that disaster represents opportunity. That is not the world that we want. We want to remind actors out there, even in the face of disaster, we are able to work together collaboratively, and we're going to work hard to ensure others cannot take advantage of that opportunity.
Admiral Rogers, I got to ask real quick, why haven't we been able to galvanize that international response? What do you think is the...
Well, I think part of it is, as a nation, we have sent out over the last several years very conflicting messages about how much we, the United States, value the broader collaborative international world around us. We're questioning this in a way that you hadn't seen literally since we created, and remember, it was the United States in the post-World War II environment that largely drove the creation of many of the structures that for the last 70 years have generally been used as the building blocks to address global problems. Now, you can argue if they've been effective or not, whether you're a fan of the World Trade Organization, the World Health Organization, the United Nations, NATO, you fill in the blank. But traditionally, up until I would say a few years ago, our broad strategy as a nation from a national security perspective had been to use those structures as the basic building block to enable a global kind of approach to addressing issues. Within the last few years, we have seemingly stepped back and argued, we're not sure that those institutions have really created benefit for the United States. Because they haven't created benefit for the United States, we now question their value. We've publicly questioned our willingness to support. And so where traditionally most nations around the world, particularly in times of stress, tended to look to the US to be the leader from a global perspective, we to date have largely been unwilling to do that in many areas, not in all, but in many areas. And I think part of the challenge here is people have traditionally looked at us and we're not filling that role right now. And no one else. Now you can make the argument, well, someone else should do it. The reality is no one else has stepped up, and there's very few, if any, that can replicate our scale of economic capability, political capability, the friends and alliances that we have around the world. There is no other nation of the world that can match that. It's a huge source of strength for us, even if we don't always recognize it as a benefit or as value. I think this is one area, bottom line, where we're our own worst enemy of late. I wish we would change that.
We could have a whole panel discussion just on this topic.
Right. And we're actually getting tons and tons of questions. You guys, everything you're saying is really spurring a lot of questions. So let me throw one to you all. One of them is, how is the COVID experience going to affect the permeability of international boundaries? No one can remember US citizens being barred from entering the EU. How long will that last? Will my passport now require me to have antibodies to visit Europe? Dr. Lucy, you've been traveling to all the hotspots of infectious disease for the majority of your career. What do you think about this? Oh, you're muted.
Okay, so this is an unprecedented time. I don't think you can really draw any meaningful direct analogies to prior epidemics, to the situation that we're in now, and to specifically the situation with regard to this, what I call epidemic within the pandemic in our country, in the United States, which has resulted in what you just alluded to in terms of Americans not being able to go to Europe in ways that we always have before. So, and more generally, I think that myself included, we've made analogies or tried to make analogies and still are making analogies between this pandemic and this coronavirus to other historical precedents, such as influenza, particularly pandemic influenza. And I'd say that one very important lesson that we should learn now, have learned and apply as of today, is that pandemic influenza nor MERS coronavirus or SARS coronavirus, they don't apply to this pandemic, this SARS coronavirus too. It's making its own rules as we go forward. And just another specific example is we talk about, myself included, but up until recently, first wave and second wave of the pandemic. And it's really arguing by analogy to pandemic influenza, particularly going all the way back, like Admiral Rogers said, to the 1918 pandemic of flu, the worst human pandemic of flu that we know of, where there was a very distinct first wave and then a worse second wave. That's, in my opinion, that's a false analogy, and we really should stop operating under the assumptions thereof. The first wave, so-called here, is hit, and now it's just getting worse. I think as a country, we could think of it in terms of the pandemic in terms of high tide waves and then low tide waves, and then other parts of the country, high tide waves. So New York City, New Jersey was high tide before March, now it's low tide, but as we know, Texas, parts of California, Arizona, Florida, it's high tide waves. So the first thing is to stop thinking by analogy and start thinking creatively about this brand new unprecedented situation. Specific example that you asked about, Leslie, in terms of the, sorry, Dr. Will, in terms of the passport, immunity passport, so-called, I think honestly, when Chile first proposed that a few months ago, the WHO, World Health Organization, was really against it. And it's basically because we don't have a lot of confidence, or we don't have sufficient confidence in the accuracy of the antibody tests and what they really mean. Do they mean that you're protected? And if so, for how long? But also many of the antibody tests are unreliable. They give false positive and false negative tests. So we're in a very, very difficult, unprecedented historical situation, but it's our life and it's our world, it's our country, it's our planet, it's our species now. So we have to think creatively, act creatively, and do much better collaboratively.
Hey, Leslie, you know, and it won't just be nation states. Think about this from a business perspective. So if you're trying to bring everybody back physically together, you know, what measures and controls do businesses put in place? Hey, if you can't certify that you are healthy, whether it's we're going to take your temperature, whether we're going to do a test at the door, hey, you're not physically getting into work. Look at what we did post 9/11. We decided, because aviation represented such a risk in a post 9/11 environment, we established a methodology that is still in place 20 years later that didn't exist before then. We decided there was so much risk associated with air travel. We put this entire regime in place. We've kept it in place for literally 2 decades now. And we now make it a precursor to travel on an airplane. You have to go through it if you want to travel in civil aviation. Do we do something similar? You know, the question was about nation states. Think though about, do we do this with any large gathering? Doesn't matter if you want to go to a concert. Doesn't matter if you want to go to an office with 100 people. Do we start to implement controls like this at a much more local level, built around access to physical access to others when you're worried about disease? I would be curious to see how this plays out, not just at a nation state level, but I would argue in a business and a day-to-day life kind of level over time.
I'll pick up on that thread, Mike. I mean, we've seen that with a lot of different companies. Everybody's struggling with exactly that. Do you come back to work? When? What are the conditions? Even coming back to work, where, and going back to the comment I made earlier, where does the work, the workplace attach? What about the commute? If you look at those of us who live in Texas, we get in our cars. But if you look at major metropolitan areas, the real risk is actually the public transportation, buses, et cetera, et cetera. So where does that employer, where does that duty of care attach? So if you say it's at your perimeter and you test there, but you're exposing everybody on the to and from, how many people, what's the social distancing rule? What do you do internally? What about HVAC? I've been through, with myself and a number of my colleagues in other institutions. People are really struggling with what is that? And then if you move into, assuming you could even define the standard, then what technology are you going to use to measure that? Who owns that data? What is it susceptible to? And then the overlay on it, and I'll say this, and the lawyers, as we know, can screw up anything. The overlay of privacy, employment law. What does that mean? And what if you're an employee and say, well, I want to come back to work, but I don't want to be tested? Do you have the legal right to do that? And depends on maybe you do, maybe you don't. It depends on what the nature of your business is. It depends on where you sit jurisdictionally. And it varies so much that it's just another one of these policy issues of where are we going to draw that line? And particularly on the privacy aspect, it's becoming incredibly complicated. Companies want to do exactly what you're talking about. They want to do it because they want to protect their workforce. It's not a liability thing. It's actually wanting to provide a safe environment, but they're really struggling trying to figure out how to do that. And from hours of conversations with my colleagues, nobody really has an answer. And it's part technology, part law, and part policy. Incredibly complex.
Well, and building on a lot of what everyone's talking about, we are getting a lot of questions asking about WHO, World Health Organization. What is their role in this? And another one that just came in, Foreign Minister of China just gave a speech calling for positive energy between China and the US. Is dealing with COVID-19 one dimension of a US response? So what are your thoughts about World Health Organization and who should be leading this effort?
Well, I'll just start. I'll jump into that real quick, and but let others pick up on the thread. And I'm sure we all have some differing opinions on this. And I would just say first, we need a healthy World Health Organization, but there's certainly a lot of criticisms out there. World Health Organization, United States response, other government response. And so there's going to be a time and a place that we need to do a very careful, thoughtful after action, and that's not clouded by politicization. We need somehow, at least in the United States, and I don't know how, but a nonpartisan, thoughtful analysis after action. In fact, I think we need something on the style of a 911 commission after the terrible attacks in September 11th of 2001. We need some type of very similar process that we can look back, but also look forward. Most importantly, look forward to learn how to live with the viruses, and the virus is yet to come our way. But part of that, I hope that analysis will also reveal the importance of working with the international community, that we do have to have the strong partnerships across the world, and it just requires that, and I hope we can reestablish a a leadership role for the United States, you know, in the international community as well. You know, the WHO was very hard on itself after the Ebola of 2014, 2016. And, you know, I think they will similarly probably be pretty hard on themselves as well, as there will be certainly calls for their own after action and reform of the WHO. But we're going to have to think about that. You know, it is, you know, what is the role of the WHO in the future? You know, are there other opportunities, or, you know, for multilateral type response organizations, vice the scientific kind of technical advisory aspects of organizations and so forth? Because there are other responding organizations within the United Nations that deals with other hazards. So I think we need to really think broadly whenever the time comes that we do the thoughtful after actions, not only in the United States for our domestic preparedness response, but also as we participate in the international community of communities, and what's the right role for response on the global stage. And I'll stop there.
No other takers on that one?
I'll add one. Dr.
Okay.
Lucy, go ahead. Dr. Lucy, did you want to say something?
Just briefly, but Mike, go ahead.
Okay, the only thing I was going to say was, look, the WHO may not be the answer. I am not a medical professional, but I am struck by there is value in some construct, some mechanism for us to bring together in a standing, ongoing way, you know, access to medical expertise and the ability to coordinate globally on a regular, ongoing, recurring basis. Not, well, you don't activate this thing until things go horribly wrong. I'm like, that's not the way medicine works. Even I, as a non-doctor, would say that's not really optimal. We've got to come up with some structure that works. And the WHO may not be the answer, but there shouldn't be out in anybody's mind. We need some kind of global approach to dealing with diseases like this, because diseases just don't stay broadly in many scenarios in one particular area. They just become much broader problem sets. Over to you, Dr.
I'd just like to add a couple things briefly then. As we know, this week, the United States formally announced that they're going to withdraw from the World Health Organization. It won't take effect until next July 6th of 2021. Secondly, that today, to Jerry's point, that today the Director General of the World Health Organization, Dr. Tedros, announced that in fact there is a what he called an independent pandemic and preparedness response panel reviewing the WHO's activities so far. And it's going to be chaired by two distinguished people. One is the former Liberian President Ellen Johnson Sirleaf, who was president during Ebola and during the civil wars and many other things in Liberia. Someone I have great respect for, and also the former Prime Minister of New Zealand, I believe, Helen Clark, who I don't know, but I think that it's important that they get started on that now, that review. And also tomorrow there's a WHO team, World Health Organization team landing in China. That's the advanced team for a larger team that hopefully will arrive within maybe by the end of this month, hopefully, to initiate a formal investigation as to the origin of this SARS coronavirus 2 virus and hence the COVID pandemic. I think that's been a big issue for many countries, not only for the United States. And then with regard to what Admiral Rogers, I think, was referring to in a general sense, and more specifically, the World Health Organization has a fulcrum point, in my opinion, with regard to epidemics. It's something called declaring or not declaring a public health emergency of international concern, abbreviated PHEIC. It's a very important legal public health action that they've only done sparingly, approximately 6 times since 2009. But in my view, at least since the one in Ebola and even the one in Zika in 2016 and the one in Ebola in the Eastern Congo in 2018, and this one they were all delayed in a very unfortunate manner. And that has to change. Perhaps there's another alert that goes out, a different type of alert other than this public health emergency of international concern, which involves a lot of basically politics and not purely medical or public health issues, which I think has done us wrong as a world for this pandemic and for earlier ones, particularly Ebola in West Africa in 2014. I'll stop there.
All right, well, I will ask another question from the list. There's a bunch about World Health Organization, but there's another one that's sort of going back to what you all were discussing with role of government and industry. And this one is particularly about 5G cellular technology. How is it going to improve our lives, how we work, and how soon we can see the benefits? And what are the geopolitical ramifications of 5G?
Yeah, I'll take a cut at this. This is an issue I spent a lot of time in my government time dealing with and since I got out. So first of all, what is 5G? 5G stands for fifth generation associated with cellular phone technology. It is not a simple arithmetic progression. Hey, it's one better than 4G was, which is the kind of the current advanced standard, although most nations around the world are still in 3G technology. 4G is kind of the standard broadly across the US and much of the Western industrialized world. What 5G does and why it's gotten so much attention is 5G uses a level of technology that will enable your portable digital device to operate at speeds, bandwidth, it'll remove latency issues that truly will enable remote devices to execute levels of activity that we traditionally associated with desktops and mainframes. I mean, it is orders of magnitude in terms of the ability to access data at speed, and access data in volume. So it's not just, hey, it's just one incremental increase in cellular phone capability. It's much more than that. If you look at some of the automated capabilities we're talking about as a society, automated vehicles, the ability to automate a whole host of functions, the ability to do that is all underpinned by a network that enables constant, uninterrupted connectivity with these entities that are remotely operating. So that enables them to harness the power of a network to be monitored and to move information back and forth. 5G is going to be the building block for all of that. It will enable us to have a level of connectivity that the world has never seen before. So it is a significant event over and above, well, it's just better cell phone technology. Because of the fact that it is likely to be the building block for so much future technology, it has taken on some significant national security concerns and has led governments to ask themselves, so if this 5G technology is going to be so foundational to the future, how comfortable am I in who controls that technology? What entities are providing that technology? And that's really where the Huawei pieces come in. Huawei is probably the global leader in 5G technology. It has a bigger market share in the 5G arena, literally, than any other company in the world. There's no US company right now in terms of 5G technology that is competing head to head well. It's certainly at the same price point as Huawei. And so because this technology is going to be so foundational to capability and economic activity in the future, you got nation states arguing, so there's a national security implication here. And we need some level of control and comfort as to who, i.e. what companies and what nations are they associated with? You know, who is installing this equipment? Where is the equipment being purchased from? Are there supply chain problems we need to worry about? And specifically what the issue is for the US with Huawei, it's kind of the global leader right now in 5G, is the United States is asking the question, so are you comfortable with a company associated with an authoritarian state, in this case China, whose legal regime, the law in China, compels any Chinese company to execute the direction of the government in a way that, quite frankly, doesn't exist in the United States. There are legal protections in the US structure designed to ensure that the US government can't just order a company to do whatever the US government wants. Those protections don't exist in China. And so you have people asking, so should I be worried about the fact that, you know, a company associated with an authoritarian state potentially is going to be the provider of this critical backbone for the future? And the US position is, yes, you should be concerned. Other nations have argued, no, it really isn't a big factor. You shouldn't be worried. This should all be about economic competitiveness, and Huawei should be allowed. I am one of those who shares concerns about, for some aspects of 5G, because I think it's going to be so foundational to economic competitiveness in the digital economy, because I think there are national security implications associated with that economic competitiveness. I do believe it's a very valid question to ask. What parts of infrastructure are you comfortable with companies associated with authoritarian states being the provider versus what areas are you not? Because there's many areas where I'd be perfectly comfortable with Chinese technology as the building block, where I would say, hey, the risk is reasonable and it's nothing that can't be mitigated. On the other hand, there are areas where I personally would argue that's an awful big risk, because in the end, I don't care what the company says. The law says if the Chinese government directs them to do it, they have to do it. That could be stop service, stop providing. That could be allowing Chinese government access. There's a whole lot of different scenarios that are available legally to authoritarian states that just aren't in democratic regimes. So it's a very valid concern. You're going to see this play out. Right now it's 5G. I would argue that's just the first of a whole series of technologies you're going to see coming down the road where we're going to have these similar kind of questions.
Yeah, I'll pick up on what Mike just said. I mean, I think 5G is a perfect example, but you have this tension between the internal national security of any nation and the supply chain issues. I mean, you're talking about this in this instance of that type of technology. The same thing applies. And I think Dr. Parker, you could talk to this much better than I can. But on the pharmaceutical side, there's any number of other issues that are going to come up on this, and this tension on the policy and strategy side of how do you support innovation, competitiveness, and yet come back to the relative national security and avoid that isolationism, temptation and these kinds of things, where we have to deal with all these issues, globally, whether we like it or not. As has been said, the pandemic doesn't care about borders, and if you look at other issues, we're so interconnected that it's impossible to think of a world where we disconnect. So how do we deal with that tension on the policy, national security, and yet the reality of we're all in this together? Again, I don't have the answers on that, but there's going to be a lot of you look at an industry may not care about those borders quite as much either, because the big entities that are capable of providing this level of innovation, as a general rule, don't sit in one jurisdiction. So a lot of things to be sorted out there. I think, Mike, you laid that out well from the 5G. But as you say, it's going to go across any number of other industries very, very soon, if not already. That is the competitive field that has to get sorted out. So just wanted to expand that a little bit beyond just 5G.
Yeah, and if I can throw in maybe a specific example, as we have clearly in the digital economy, and 5G is our next kind of step into that digital economy, we are also emerging into the bioeconomy. I think this century is finally going to be the century of biotechnology and biology, and that fundamentally gets down to just digits as well with the genomics and proteomics and all the other omics. And so we've entered the era of the bioeconomy, and I think that's going to require a lot of policy conversations and discussions about how we do that on the global scale, but also make sure that we do not enable dangerous vulnerabilities in the United States.
Great. We're getting a lot more questions, and they're a little bit all over the place. And because we have such a diverse panel, I want to make sure I get them all. Now, this one is asking a little bit more about, in case we don't get a vaccine, what about the drugs? Are there drugs? Is there an update on drugs we can talk about? And as maybe a bridge between now and if or when we get a vaccine? Maybe Dr. Lucy?
Thank you. So I'll be brief here. It's a very large field, but so the answer I'd say is twofold. One is drugs, and so far there's been two that have been shown to be definitely helpful. One is called remdesivir. It's made by a US company, but right now it can only be given in the vein. So it's not a pill that you can take by mouth. It doesn't decrease mortality, but it decreases how long it takes for you to get better and get out of the hospital. The second drug is called, it's a type of a steroid, it's called dexamethasone. It does decrease the death rate. So that's very important. It makes it less likely that you'll die if you're on a breathing machine or otherwise requiring a lot of oxygen. So that's very good news. It's also quite inexpensive and available around the world. Then, as you know, there are many other drugs, but in my view, none of them have been shown to be safe and effective. The other bridge, if you will, to use the questioner's term, is antibodies. And there's several different kinds of antibodies, but now those are being sort of championed just in the past few days as a bridge until we get a vaccine. In other words, the antibodies can be ones that I might have if I've survived COVID-19, and then those antibodies can be taken from my blood and given to someone in their vein who's very sick in the hospital with COVID. But in addition, it's now being studied whether antibodies, either the types from survivors of COVID or types that are made in a laboratory called monoclonal antibodies, can be used as prevention to be given to someone who does not have the disease, does not have the infection, but was exposed or is at high risk for being exposed. So that could be family members of someone with the disease, it could be healthcare workers, could be many people, could be potentially VIPs of any sort, it could be military, et cetera, et cetera. So those are the, broadly speaking, the drugs and antibodies that might be available well before any vaccines are. I'll stop there.
Thanks. And kind of following up a little bit on that, the other question is about what we can do in the next 6 months while waiting for more information about the drugs, more information about vaccines, also with some concern about that's always a hard phrase, contract tracing, and if that will only work if there's extensive surveillance like in Asia or some European countries. So yeah, it's mostly about like, what can we do in the interim? Maybe Dr. Parker?
Sure, I'll start this off. And so there's, again, we know more about SARS-CoV-2 now than we did, even a month ago. A lot we don't know. So we have to continue to fill our knowledge gaps. But most importantly, as we think about preparedness and response, we know that the younger age demographics, at least to date, have experienced less severe disease and need for hospitalization, but they're not completely immune to that either. But we know that the older demographics, and then everybody who has underlying health comorbidities are at higher risk for disease, severe disease and death. So we have to do everything we can to try to understand how to better protect those who are at more at risk as we begin to reopen our economies and come back to work and so forth. And it's not just as simple as separating the old people and the young people. Our society is just not that simple, but we do have to figure out better ways to protect those at most risk. Part of that is going to be our ability to continue to expand our ability to test, to understand where the virus is in our communities, and do the contact tracing so we can rapidly identify those who are positive in their close contacts and take appropriate action to either quarantine or isolate. But even right now, as we're seeing the significant increase in cases, particularly along in our own state in Texas, we're already overwhelming our ability to do that contact tracing. And so it's going to be very hard. We're going to have to, figure out how to, decrease the transmission in our community. And that gets back to, we really need to be able to communicate better, and people need to listen better about the importance of individual responsibility and facial coverings. Even though the science may not be completely understood about the importance of facial coverings, it's the combination of things we do. Facial coverings, maintaining your space and when out in the community, stay home if sick, washing your hands a lot, the basics. The basic public health measures will help reduce community transmission. It's not going to prevent everything, but every percentage point that we can decrease community transmission, the better off we're going to be. We have to continue the efforts that Dr. Lucy talked about in our scientific enterprise has just been unprecedented in discovering and developing new vaccine candidates and therapeutic candidates. That has to continue, and hopefully we will be successful. There's no guarantee that we will develop some safe and effective vaccines, but there's no doubt we are already identifying some therapeutics and perhaps some preventive measures, prophylactic measures on the medical countermeasures front. But both of those, our medical countermeasures front, we also have to figure out what are the logistics for getting those life-saving vaccines or drugs to where they're needed. And that's not an easy chore. And there is our state and local, state and federal colleagues are working on those plans, how we would distribute the vaccine if we are successful. But we also have some hard policy questions. Who gets the first dose? So it's going to be a scarce medical resource at first, and we have to determine what are the priorities for getting the first doses that will become available. We can't wait until it's available to have that conversation, and it needs to be a transparent conversation with the American public as well. And then finally, I think we just have to do a better job of communication. I don't think we've earned the public trust and confidence, and that's a major gap. And I think we really have to double down and do a better job of earning. We have to earn the public trust and communication, and that's been something that has plagued us. That's a good term. Almost every kind of infectious disease outbreak that we've had, even intentional, going back to the anthrax letter attacks that occurred right after 9/11, and SARS in 2002, 2009 pandemic of H1N1, the Ebola. We just have not done a good job of communication, risk communication, and earning the public's trust. So that we have an opportunity. We've kind of lost it already, but maybe we can regain it. I'll stop there.
Leslie, I'd like to make a comment. This really goes to contact tracing and this idea that contact tracing is about new massive surveillance. I think that couldn't be further from the truth. Contact tracing is trying to harness and bringing together 3 different sets of data, all of which already exist. The first is who is positive for the virus. The second is where do those individuals go? And the third pile of data is, and who are they interacting with when they're going there? The first pile of data, who is positive, that is coming from testing. Again, that's a known. It's not, well, we got to surveil everybody. No, we want to harness the testing results that already exist. The second category of data, so where are people going? Our digital devices constantly are telling the support infrastructure, if you will, that services them where we are. That is how we get phone calls wherever we are. That is how we're able to geolocate and use services. That is all exists. It's built into the very structures that we have created. And then lastly, so who are these people that are positive? Where are they going and who are they interacting with? Again, that's largely locational data derived through cell phones, Bluetooth, that already exists, that's already out there. So one thing I try to tell people about contact tracing is this isn't about creating new massive amounts of data. This is about trying to figure out how do we maximize data that exists and connect it. Now, not that there aren't concerns with that, don't get me wrong, but I always try to say, can we take the emotion out of this and can we deal with the facts about what contact tracing is? Now, the methodology that's been tried largely to date is either people opting in, if you will, to voluntary use of technology. That has proven to be largely ineffective in the sense that the last thing I saw said something like less than 15% of people in the US are opting to voluntarily participate. So quite frankly, it's not generating the data that actually leads to accurate conclusions. The second idea was, well, we'll hire people to do this manually. We're so far behind in that, and I would also argue this becomes so challenging in a world in which the disease remains very strong. So the idea of sending thousands of people out to physically interact with other people to talk about where they've been and what they're doing, I'm not sure, I'm not a doctor, but I'm not sure that's the smartest health approach to doing this. I think it highlights a broader issue for us in that I always try to remind people, you cannot separate technology from social context. I mean, the two are intertwined. And what works in one area in an authoritarian state, what works in a representative democracy like Israel, where you're used to this idea of being under such a constant threat that you're very comfortable with your government doing some things that, quite frankly, in a representative democracy like the United States, we would say, whoa, 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 that makes us really uncomfortable. We don't like the government doing that. I think one of the challenges of COVID is we need to have a good discussion as a society about what should we be comfortable with and what should we not be comfortable with. And at what point does the greater common good drive us to be willing to apply technology to help address a health issue and to do it in a way using technology? Because there are some things that we can do with technology to help protect data that weren't available 5-10 years ago. I think there are some interesting technical things we could do, but we need a broader dialogue as a nation about, so what are we comfortable with and what are we not comfortable with? And at the moment, this is such an emotional issue, and I find so much that just isn't factually correct, that we're not really having that discussion. And I think there's a really good opportunity here to ask ourselves, so what are the things we're comfortable with? How can we harness technology to help us deal with this health issue? But at the same time, how can we do it in a way that protects our core values and the rights of the individual, and to ensure that this data that already exists but would be brought together isn't going to be misused, isn't going to be retained, isn't going to be used for other purposes well over the whole health issue.
Excellent point. Oh, Dan, did you want to say, or Dr. Lucy, did you want to say something?
Thanks. Just very briefly to follow up. Today, the Food and Drug Administration granted what they call emergency use authorization for a rapid diagnostic test for COVID-19. It's called an antigen test. And basically, it'll tell you within 30 minutes or less whether you have the infection right now. How that could be very important and almost a game changer, to use that overused term, is because it will, in theory, allow you to know the answer very quickly and without having to have a swab put up on your nose and then the test to be sent out and come back potentially days later. You'll know in less than 30 minutes, which I think in theory, and it's strictly my opinion, but it could address issues that Admiral Rogers raised and others about effective contact tracing. So in other words, if I have the infection, I get this rapid diagnostic test, antigen test, and it's positive, then it seems to me that potentially the infrastructure could be there, put in place, so that immediately there's someone there to ask me who have I been in contact with over the last however number of days. So no one needs to go out to meet with me, no one needs to call me, and I can say, no, I'm not going to tell you the answers, or I'm not going to talk with you, et cetera, et cetera. So I think this new antigen test, which isn't perfect, it misses some cases, but supposedly it correctly identifies about 80 or more %. It really could be a game changer, could be available, I hope, within the next month or two. So it's part of that 6-month, what can we do question that Dr. Parker was answering. So I'll stop there.
Thank you very much. Well, this has just been a really fantastic discussion. I really enjoyed everyone's points. And I want to thank very much our audience. We had a fantastic audience, so many questions. I apologize. I kept trying to get to as many as possible. So I guess this just means we're going to have another event. What do you think, Mr. Hopkins?
Seconded.
Great. So with that, I would like to thank Admiral Rogers, Dr. Lucy, Dr. Parker, and Mr. Hopkins. Really appreciate your insights on this, crazy new world that we're living in. Oh, we don't like to say new world. I forgot about that. The new dynamic. And I look forward to having another discussion. Keep your eye out on your emails, and we will let you know when we have the next event between Scowcroft and Dentons. Thank you very much. Stay safe out there and wear your mask.
Stay healthy, everybody.